Hi everyone, I'm Jeremy Kelly. I'm the chairman of the Myotonic Dystrophy Foundation. Welcome and thank you everyone for joining us for this first virtual conference. As I was thinking about our community, what really strikes me is just how resilient, patient, persistent you all are, and how you all have a tremendous sense of humor dealing with all of the challenges of the disease. What really hits me is in 2020, the degree of difficulty just went up a level as we're all dealing with COVID, and I hope you and your families are all safe and well. We knew going into 2020 it's a new decade, and there was change at the foundation ahead of COVID. With great advances on the research side, we realized we needed more expertise at the board level. And so we're delighted when Dr. John Day and Dr. Charles Thornton joined the board at the beginning of the year, and it's been invaluable having them as part of the team. The other huge change we had this year was in January. Dr. Tanya Stevenson joined us as our new CEO. Tanya has a master's in public health from Columbia University, where she focused on health promotion and disease prevention. And she also has a doctorate in education, focusing on health and behavioral studies. Tanya, professionally, prior to joining us, worked in AIDS education in New York City and New Jersey in the early 2000s for 5 years. And in the past 5 years, she's been the CEO of a Bay Area nonprofit, Breathe California. So we've been delighted to have Tanya come and lead the team as we go into this new decade. It's been a funny year this year. We had our first meeting with Tanya and the board back in January. We have a board offsite, and we were fortunate. One of our board members raised the issue of COVID and that it could be a major challenge for this year. And so we really switched gears back in January to figure out how best to position the foundation for this coming year. Normally with a new employee joining an organization, and especially a new CEO, that transition, there's a honeymoon period where you're getting to know each other, but it's only after 6 to 9 months that you actually find out what somebody's really like. Tanya had no honeymoon period. With COVID-19, she had to jump in right away and take complete ownership, and she really has done a fantastic job. The switching the gears for this year, as we're right now doing the virtual conference, we've obviously been doing virtual support groups during the course of the year, and we're also going to be doing a virtual gala, and we'll let you know more about that later on in the program. I'm now going to hand it over to Tanya, who is going to lead you through a state of the foundation. And the goal here is to explain to everyone where we stand and all the investment since 2007 when the foundation was started, and what we've done on kind of the three big components of what we look to do, which is the care side of our programs, the cure initiatives, and advocacy, raising the profile of our disease. And then to do it all, we also need to raise funds to do it, and we want to give you an update on how we're progressing on that front. And then finally, Tanya will walk you through the great team that we have together. So I'm delighted to have everybody here. Sorry I can't see you all in person. My credit card will be behind the bar next year in San Diego, but I'm really, really proud of everything the organization has done this year, and I'm delighted to hand it over to Tanya right now. Thanks, Tanya.
Thank you, Jeremy, and happy autumn to everyone. I feel incredibly fortunate to have been welcomed by this community. And as you said, this is a very different year for many reasons, so I'm especially thankful. And I appreciate everyone coming together during a time when, on top of a global pandemic that is really defined by social isolation, we're facing wildfires, hurricanes, economic uncertainty, the loss of a heroic Supreme Court justice, and we're engaged in a battle to address systemic racism and inequality. Throw in the fact that this is an election year, and well, the world really does feel like it has turned upside down. Alone, each of these is a lot to handle, but combined, well, some days feels beyond intense. To help keep sane, I like to think of quite a few different silver linings when I have the opportunity. Like one, there's definitely more family time, right? There's more sourdough bread baking. More pets have been adopted than ever before. There's no more long commutes to work. We're all saving money on gas. We're getting to know our neighbors a little bit better. And if I'm being honest, in my house at least, because kids have been distance learning for school since last spring, I'm actually delighted that my 11-year-old son's knowledge of technology has now surpassed mine, and he can serve as my personal IT department. The incredible shift that kids have had to make, albeit a challenge for all of us, bodes well, though, for a very brighter technological future for everyone. Perhaps the absolute most important thing for us to remember today, though, is that more people can attend the MDF conference than ever before, and that's solely due to this virtual format. This weekend, more people are accessing resources, they're talking with DM experts, they're connecting with community, and they're improving the quality of their life and those of their loved ones. That is a huge silver lining. I've been reflecting on the last 9 months at MDF, and I've been moved by the passion and drive that I've witnessed. I've had the pleasure of speaking with hundreds of you, and thank you for helping shape my understanding not just of the complexities of this disease, but the struggle, the need, and the hope that exists. Thank you for sharing with me about your lives, introducing me to your families, helping me learn, and trusting me so that I become the best possible ally and advocate to work with you to change the future of this disease. There are a few things about MDF that have stood out to me over the last few months. First and foremost, our community is the expert on DM, above and beyond all others. Your lived experience helps shape MDF's priorities, and that must remain the focus of our attention. MDF is the bridge that connects our ecosystem. We've been successful at developing a model to link the community with care, research, different resources, community regulators, and industry. And it's all taken each of these partners actively to develop this thriving network. Our community feels strongly about the foundation and rightfully takes ownership and pride in what gets accomplished and communicated. And that includes what we call ourselves. That matters because this is your foundation. Our support groups are a critical piece of the MDF system that works to connect and support some of our most vulnerable community members at times when they feel there is nowhere else to turn. Our research investments have been smart, focused, and strategic, and they are paying off. There is still a lot to do. We know that we need to educate our clinical care teams better about this disease everywhere, so that every individual receives the absolute best possible care to live a strong and healthy life. Our community has a lot to celebrate, and that's what we hope to share with you today. The progress made toward MDF's 3 core pillars, care, cure, and advocacy, have been tremendous, and we have a lot to look forward to. But before we jump into the State of the Foundation presentation, I have a couple of tips for the conference to help keep you on track. I recognize that this is most people's very first digital experience, and we are grateful that you are trying it out with us. First, I ask your forgiveness in advance if we experience some technical difficulties in this virtual environment. Almost all of today's speakers are on their home computers, and our internet connections can sometimes surprise us. So with this being the first virtual conference, we know we're going to learn a lot along the way. and we really appreciate your patience. Some of the sessions are bound to go over or under 50 minutes, and they are not likely to exceed an hour, so just keep that in mind. Everyone's camera and network all function just a little bit differently, so sometimes the speakers are going to appear crystal clear, and other times they might appear a little fuzzy or a little out of focus. And don't worry, it's probably not your computer, it's our computers. There are a few minutes between each session, so be sure to stretch, get some water, please take care of yourselves. And if you miss a session that you really wanted to view, don't worry, we are recording them. We will post them to the MDF website when the conference is over within a week or two. And, they'll be on the Digital Academy 24/7, so you can access them there anytime. As a reminder, one of the unique things about this conference is that we have a live sponsor and exhibitor showcase for at least 4 hours each day of the conference. So this allows you to go in and talk with the drug development companies, the researchers, the artists. There's tremendous talent in the DM community, and you can check out some of it in the showcase. But you can also talk with the MDF Research Fellows. You can talk with the MDF Board of Directors. They're there to answer your questions and help you to learn a little bit more. As Jeremy mentioned, our goal in this opening session is to share with you the progress that we've made so far, provide a snapshot of where we are now, and help bring us together just a little closer by identifying our shared priorities. When I arrived, I promised my team and our community transparency and absolute collaboration. And that's what this presentation was designed with in mind. We want you to know what's happening at MDF. We want you to know where our effort is placed, and we want you to know how we spend the money. This is your foundation. We work for you to help improve the quality of your life and to help find a cure. If you're curious about our activities, give me a call. I want to talk with you. I want to learn from you, and I would look forward to talking. Okay, I want to switch because I want to be conscious of time, and I want to go to our slides so we can share a little bit more about what's been going on at MDF. Here are a few highlights of what we will cover in the State of the Foundation presentation. MDF is entering this new decade with over 25,000 members in our database. Despite these challenging times, we've added many new resources just this year. Our research investment has grown. We fund the next generation of researchers via our MDF Research Fellowship Program, and we invest in tools to be used by both researchers and industry. This may be a good time to mention that we use the term industry a lot. It's a catch-all phrase to describe the biotechnology and the pharmaceutical companies who are working toward treatment and a cure. Our advocacy has resulted in increased funding among lawmakers and more than $150 million in research funding for DM. MDF has raised and invested more than $20 million. Our budget has more than doubled during the last decade, enabling us to invest more in care, cure, and advocacy. Okay, so let's take a little bit closer look at these numbers as we have invested over $4 million in our care programs. So those 25,000 people in our database, their families, their individuals living with DM, their caregivers, clinical care team members, researchers, friends, supporters, donors. MDF is where people turn when they're recently diagnosed, when they need support or resources. And we continue to raise awareness of the disease, so we ignite new interest in treatment and quality of life improvement. So we're hoping that this number will continue to grow as well. Our conference attendance since 2012 has increased considerably, and we hope it will continue in that direction. This is your event, designed with your feedback, and we're excited that even in this virtual event, we have more than 600 people registered this year. We introduced the professional track back in 2016, so DM professionals like researchers and clinicians could come together and learn from one another. That will return again next year when we are in person in San Diego. One of the incredible strengths of this organization, I believe, is this wonderful network of both support groups and support group facilitators. We have them geographically spread out across the country as well as into Canada. And we additionally have an international German language support group as well as an online Facebook groups for DM, including a DM happy hour thanks to Mindy Kim. Some of our support groups have been meeting for over 10 years, and others have just recently started, like the one in Canada, thanks to Teresa Buffone for starting one in Ottawa. Our DM days are currently on hold through the pandemic. They're special one-day events that bring together MDF clinicians, researchers to support the myotonic dystrophy patient and family community. These are held at different universities and medical centers. Experts share with the local community about different DM-related topics. It's a way to bring more recent knowledge and research directly to families in their own communities. So the Myotonic Family Registry is the world's largest myotonic dystrophy-only registry. And it's an important database where people with myotonic dystrophy can register to share information about how they are managing myotonic dystrophy, including noting some of the specific symptoms that they have. And registry information helps researchers and drug companies develop new treatments. And when those treatments are ready, the registry is used to contact participants for clinical trials. So the unique thing, I think, about this registry is that once you register, you can also access the very high-level data that's available. So you won't know exactly who said what, who entered what information about themselves, but you'll see it all in a de-identified aggregate format, and that's not common among all of the registries. So it's a unique opportunity to take a look at what is happening in our DM community. And if you aren't registered, please, by all means, do register. This is a critical database, and you can go to the Resources tab on the menu of the conference homepage, and you can also register on the MDF main website. In terms of communication, we are reaching more people than ever before. We now have over 5,000 Facebook friends, and we've seen a 62% increase, or growth rate rather, in the number of resource downloads from our website in only 4 years. Our anesthesia guidelines are still one of our most commonly downloaded resources, and our COVID-19 recommendations have been downloaded thousands of times. And that's just in the last few months, as you can imagine. Last year alone, MDF's online resources were downloaded nearly 34,000 times. MDF has worked to produce hundreds of different guidelines and toolkits and resources for our community and videos as well. These resources are critical, as most of you have experienced. You often have to educate your own clinical care teams and advocate strongly for proper care for DM. Well, this is definitely the place to find assistance, as we have convened some of the world's leading experts to help develop these tools. We know the anesthesia guidelines and the toolkits have helped save lives, and we will continue to develop these resources until there is a cure. I think it's also important to note that our community is our strongest and most powerful resource. Sometimes the community members actually serve as reviewers for these resources. And I'll give you an example. A few months ago, I was speaking with Rebecca in Oregon. And at some point in our conversation, she asked, what else can I do for the Myotonic Dystrophy Foundation? And I love when people ask that, because there is so much that you can do. And what we did is, in a couple of days, a matter of days, she was helping to review some of the resources that we had under development at the time. And because of her lived experience, she made significant contributions to improving the documents before they were published. It's, I think, the community expertise, willingness to share that expertise, and philosophy of collaboration that helps make these resources more relevant and valuable. When the coronavirus arrived, we knew we needed to get information out to the community and to provide people with something to look forward to while they were at home. So we created a Friday afternoon webinar series, and we invited our DM experts in our network to talk with us about topics we knew people wanted to hear about. Those recordings, all 10 of these, are now available on our digital academy, and that's on our website, and you can view them anytime, 24/7. And as you can see, they've already been viewed hundreds of times individually as well. Okay, we're transitioning to our Cure platform. And as you can see, we have invested over $10 million in the last decade on research-related activities. So through our fellowship, our research fellowship program, funded in collaboration with MDF UK, we are helping to develop the next generation of DM experts. We have funded 34 fellows from world-renowned institutions since the program began in 2009. And why is this important? Well, this investment pays incredible dividends. Most past fellows report staying active in DM research throughout their careers. So they often go on to run their own labs, and some of them now are even mentoring younger MDF fellows. Some of the people presenting in sessions today and tomorrow, including Dr. Eric Wang and Dr. Nicholas Johnson, were once MDF fellows themselves. The 6 MDF fellows who were funded for 2020 are also here with us, and they will be live in their booths during the exhibitor showcase. So in addition to helping develop DM expertise early in careers, MDF has invested heavily in research over the last 5 years in particular. So I'm proud to say that even during the pandemic, when a lot of other organizations were cutting investments and scaling back projects, that the MDF Board of Directors made a conscious decision to keep moving forward and maintain our research investment without cutting funding. Our scientific advisory committee helps us determine where the roadblocks to treatment might be so that we can fund research to eliminate those barriers. MDF works to de-risk research investment for the government and for industry, because if we don't invest in the pilot studies or take chances on major initiatives to help us make new discoveries, who will? The results of our research investments have definitely paid off, as some of the research projects' results have been remarkable enough that those investigators have since gone on to the National Institutes of Health and the Department of Defense to request and receive additional funding to expand into much larger initiatives. And really, although DM is our obvious #1 priority, it goes without saying that the results of our triplet repeat research investments could also potentially benefit other diseases as well. So the slide that you're looking at now consists of several examples of recent investments that we've made in research, a couple of them active and a couple of them have already been completed. So the first one is our natural history data capture. And originally consisting of only 5 sites, MDF supported the expansion of a 16-site clinical research network to increase the efficiency of testing new DM drug candidates, increase the size and scope of sites trained, and support experienced and resourced professionals to deliver clinical trials for potential therapies. The network includes a central database, a real-time industry data sharing program, and standardized ongoing clinical research coordinator training. The DM Clinical Research Network now includes 15 sites across the globe, enrolling patients and participants to really better understand the disease progression. So next on our list is the Reach DM project, and this is just in time for social distancing and telemedicine needs in a pandemic because the University of Rochester is exploring the feasibility of remote genetic testing and disease assessments. And the University of Rochester is also here in the exhibit booth today in the showcase. We've invested in a successful mouse drug testing facility through Jackson Labs. And the goal here was to create standard operating procedures for testing DM drugs on mice to determine if they are effective enough to deliver lasting changes. This facility is functioning, and our industry partners are currently using the facility to test their compounds. The burden of disease study that you see next it was a small grant to the Mayo Clinic and Optum Labs to review 785 DM patient records and determine the cost of disease diagnosis and progression, which we don't have a lot of information about. The soon-to-be published results will help medical and insurance communities work more efficiently with DM patients to better understand the actual cost to families. The information gathered also supports efforts to ensure that more patient costs specifically are covered by insurance companies. So next project you see is we've invested recently in the development of induced pluripotent stem cell lines for both DM1 and DM2. These cell lines allow researchers and industry to test targets against DM and to understand cell changes as the natural history of DM progresses. MDF has made sure these are available without licensing fees or reach through on intellectual property, ensuring that commercial development efforts are unhindered. And last, what you see on here is the population-based prevalence study, which found myotonic dystrophy to be far more common than was once believed. So we thought it was common among about 1 out of every 8,000 people in the US, but what we have found with this study is that it looks to be common among 1 every 2,200 or so people, which suggests that DM is still a very rare disease, but there are a lot more people out there with myotonic dystrophy than we realized. This gets people's attention. It draws a more responsive focus on myotonic dystrophy as parties that may otherwise have overlooked this disease start paying attention. So I think it's important that we step back and take a look at how funds are invested in DM across different sectors. So a few years ago, there was very little interest in myotonic dystrophy. Now there are more than 40 companies interested and working to develop potential treatments. You can find the latest DM drug development pipeline, courtesy of Newcastle University, on the conference website under the Resources tab, and also on our main MDF website. The National Institutes of Health has been supporting some DM research, about $12 or $13 million a year for the last few years. And that's exciting for us because, you know, when they seek to provide that funding in the form of grants, which, you know, encourages investigators to look for new discoveries and advance DM science. But it helps us because the more research dollars there are that are out there, the more people we have studying myotonic dystrophy. So private equity firms have invested millions of dollars, over 125 million in the last 3 years alone, in companies that are working on DM treatments. We know that the number of individuals in the world is estimated to be individuals living with DM is estimated to be approximately 1 million, with about 150,000 in the US. And while global research and development spending is about $200 billion a year, most of the time, as you know, that is spent on diseases with the most attractive profiles. And the current estimated DM population, though, in the US may create a $5 to $20 billion market opportunity. So myotonic dystrophy's profile is now more compelling than ever for industry and for government research. And the role of MDF here has been to help define that market size and the cost burden, ensure research infrastructure, and prepare individuals, researchers, and the FDA for therapies. Okay, I've been talking a while, so I'm going to hand this back over to Jeremy to discuss advocacy and fundraising. Take it away, Jeremy.
Thank you, Tanya, for that great overview of what we've achieved since 2007 on the care and cure side. I'd now like to walk you through what we've done on the advocacy side. Since 2007, we've invested around $2.5 million to increase DM awareness amongst lawmakers and obtain government funding for research. What this has resulted is in over 150 million of government funding for our disease since 2007. The highlights are outlined on what we've achieved here since 2014. Kayla Vidic and her mum Lisa testified before Congress in 2014 in support of the reauthorization of the ND CARE Act, which was very important. At the bottom of each year, you'll see how much money the NIH put into funding for myotonic dystrophy research. The other thing that we did in the mid-2014 to 17 period was we went on the road with our annual conference, and we had the conference for 3 years in DC to increase our advocacy on the Hill. So in 2015, we had 80 members of our community featuring in a congressional briefing on DM research funding, as well as going to the Hill during the family conference. In 2016, what we did, the foundation did approach the FDA. The FDA is the organization that approves drugs. And the key job that the FDA has to do is they look at the risk reward of any drug in the approval process. And everything in life has a risk, but the other important component is what is the reward from a certain therapeutic approach. And what was clear was the FDA knew little about myotonic dystrophy. So we actually funded and hosted a patient-focused drug development meeting in 2016. We had 8 members of our community, a bit like a Senate hearing, present to the FDA what it's like to live with myotonic dystrophy. And we had about 80 people in the room, but what was exciting was the FDA really appreciated getting the education, and we got great feedback from it. But also we had drug companies in the back of the room as well, and for them to see that we're essentially laying the path so that the FDA is already educated as and when drugs do come to market. That was a huge de-risking moment on, something we're very proud of from an advocacy standpoint. 2017, we had an initiative to commit Social Security to add congenital DM to the Compassionate Allowance Program so that our community can quickly qualify for disability benefits, including healthcare insurance. And then we also reported back to the FDA with the patient report from the meeting from the previous year. Another key initiative in 2018 and 19, and we've been working with Kevin Brennan during this time period. He's been our consultant who's really spearheaded these initiatives along with key members of our community. But we approached in 2018, the Department of Defense Peer Review Medical Research Program, which is essentially another pool of federal funds. And we got myotonic dystrophy added to their list of approved diseases. And the exciting thing is that initiative in 2018, and then you can then see in 2019, we've had $5.5 million of grants that have gone into our field as a result of that initiative. We had Tim Halon testify before the House Appropriations Committee in 2019 to increase federal funding for DM, the NIH. And then finally this year, there's a DM research provision in the House Appropriations report supporting current efforts to develop the first ever FDA-approved treatment for this genetic disease. I think what comes out of all of this is we're all advocates for this disease. We're walking through some highlights here, but we've had a lot of our community go to their senators and congressmen and really advocate for our disease to the representatives that we have. And there will be a session tomorrow on advocacy run by Kevin. Kevin has been part of our team for more than 5 years and really has spearheaded our efforts on the advocacy side. I'd now like to walk you through the fundraising and what we've achieved on that front. So since 2007, when the foundation was started, we've raised $23 million from various sources. And obviously, this provides the critical resources for the care, cure, and advocacy initiatives, and to fund the MDF, the staffing resource, and all our other various initiatives. So what does the landscape look like? So when we started out in 2007 to 2010, we were raising around $500,000 a year. I'm delighted to share with you that since 2015, so for 4 of the past 5 years, we've raised over $2 million, which is a tremendous increase from where we were in the early days. One caveat I'd have around that is raising money in a COVID environment, I think, will be more challenging. We've got off to a great start this year, but we may end up coming in at a lower level than we did last year. But as a board, we've adjusted the budget, and we also have financial reserves to get us through a period like this. So from a financial standpoint, the foundation is actually in very good shape. As a nonprofit, obviously the more money we raise, the more we can do on the care, cure, and advocacy side. In addition, in the red box down below, we have had 2 remarkable donations to the organization. We had a $6 million investment from the WIC Foundation and $1 million from an anonymous donor for gene editing research. So that, in addition to the numbers in the bar chart, brings the total raise to $23 million. The other exciting thing is looking at the number of individual donors. The more donors you have, the broader your funding base, the more stable you become. And we're really excited to share with you that since 2015, we've gone from 2,200 donors to 4,600. And obviously that's significantly up from around the 500 we had back in 2007. And a big component of that has been the tremendous work that all of you in the community have been doing with grassroots efforts, with personal fundraisers, the Facebook fundraisers, and obviously the bigger the donor base, the more we can do with our mission. As I was mentioning, grassroots fundraising have become increasingly popular and a key source of donations. It's also a great way to build community and reach out to your networks to ask for help and raise critical funds to support our mission. In 2019 alone, grassroots fundraisers raised $120,000, which is remarkable. We had 15 major fundraisers since 2017. We've had golf competitions, backyard crayfish boils, which you can see in the middle top photo. That happens every year. Marathons, bike rides, and Facebook birthday campaigns. And annual events take place around the country. The other point that I would highlight is we're raising a lot of funds are coming in through Facebook. We've had more than 3,500 individual Facebook donations through grassroots efforts. The other big fundraiser that we have, and actually where we raise the most money, is we have a gala each year. Last year was our most successful gala to date. We raised $1 million in a single evening. We had 500 people in attendance, and the event took place in Paramount Studios in LA, and Martha Montague Brown did a phenomenal job chairing that event. Obviously this year we're switching gears, and we're going to be doing a virtual gala. We're really excited about this. The big news is that the gala is free. Everybody can attend, so I would strongly recommend, encourage as many of you as possible to reach out to your friends and your network and invite them. It's a 1-hour event. It takes place on Friday, October the 23rd. It's from 5:30 to 6:30 Pacific time, and it should be a lot of fun. We have a lot of voices being shared from our community that are highlighting the great work that the foundation is going. And you can see over on the right-hand side, the only thing that, and you've heard this from me and for a number of years, the only thing that rhymes with myotonic is gin and tonic. So we have a signature gin and myotonic cocktail down in the bottom right-hand corner. But it will be great to have as many of you join us for what promises to be a really fun hour and the biggest fundraiser of the year. I'd now like to turn it back over to Tanya to walk you through the team, and thank you.
Okay, thank you, Jeremy. I know we are getting near to the end of our time, but I want to be sure to spend a few minutes to thank and acknowledge the people who help MDF accomplish all of this wonderful work. First off is our small but mighty team at MDF. When COVID hit and we all began working from home, I didn't know what to expect. I'd only been with my team for 2 months. I was still getting to know them. And I must say, I was incredibly impressed with how well they all stepped up during the transition and didn't skip a beat. I want to acknowledge the level of commitment that takes. And I'm super grateful because I look forward to coming out of this COVID era where we'll have a chance to actually work together again in the same office. And I'm particularly excited because when we do go back to the office, it's a brand new office in a historic district in downtown Oakland, and it'll be really exciting for us. So for just a minute, I'll tell you a little bit about these folks. Many of you probably already know us all, but Leah is our program director, and she's responsible for the development of resources. She is working with our support group facilitators on a regular basis. She runs the MDF warm line. She's coordinating our DM days or our medical school road shows. She does a lot. Cleed is our communications and technology manager who designs and manages our websites, including this website and our Gala website, if you haven't checked it out yet. He's also responsible for the monthly dispatch e-newsletter, MDF social media, and our internal technology. Additionally, he coordinates the DM family registry for us. Sarah is our development associate who works with our grassroots fundraisers across the country, helping them make sure they have everything they need to be successful. She processes our donations and she works with our sponsors, and she's also a great graphic designer on top of that. Allison is our senior science advisor who works primarily on our Cure platform. And she works with our industry partners, researchers, and our community to find the best connections. Nadine is our research coordinator who works with our scientific advisory committee to help select and engage our research fellows and our other institutional grantees throughout the year. And he's not pictured here, but as Jeremy mentioned earlier, Kevin Brennan of Bluebird Strategies is definitely considered one of our team members. He's the one who's working in DC on our behalf to advocate for DM research and funding. He's holding a session tomorrow if you are interested in learning more. I want to again acknowledge the incredible support group facilitators who help connect our community with resources, with research, and they just have become a friendly face for people to rely on. They are a key lifeline for hundreds of people, and MDF would not be as strong or as successful without them. Even though many of them had never facilitated a meeting in a virtual environment before, when COVID happened, they stepped up and they learned new technology, and they have successfully shifted to this virtual format to ensure that the DM community can still hold meetings and can connect during this difficult time. Our scientific advisory committee helps us ensure that we are headed in the right direction with our research investments, including our fellowships and our research grants. Combined, these incredible and unbelievable scientists have over 100 years of DM experience. And of course, our amazing and phenomenal board of directors. These are volunteers who work to ensure the financial and the structural health of our organization, and they definitely help raise lots of money to make sure that we can continue advancing our mission. This is honestly the most engaged board of directors, engaged and active board of directors I have ever had the pleasure and privilege of working with. And I know that not a day goes by when they aren't actively thinking about how to make a difference in the lives of people living with myotonic dystrophy. Our board members are all personally affected by DM, or their families are affected, or their closest friends are affected. They are absolutely dedicated to eliminating this disease, and I invite you to go and talk with them in their board booth during the exhibit hours. I would be remiss not to thank all of the incredible sponsors without whom this event would not be possible. I especially want to call out our conference partners and our gold level sponsors, Avidity and Ionis, who partnered with us to make sure that this event was accessible and happened in a virtual format so that we would not miss a conference year. When it became clear that COVID was going to significantly impact our daily living, we canceled our in-person event. We want to make sure that the health and the safety of our community remains our #1 priority, and we did not want to take any risks. We didn't believe at that time that we could hold a virtual conference, and we certainly didn't think that we would be able to fund it. But thanks to our sponsors, the nearly 600 of us are here today. So thank you to Avidity, Ionis, Harmony, Dyne, AMO, AskBio, Biogen, Expansion, Lupin, Vertex, Syros, Pfizer, and Audentes. We are truly grateful for your support of the DM community. So that wraps up the State of the Foundation presentation. I hope you found it helpful. I'm happy to talk with you about any of these areas that we have advanced in over the years, or if you would like to talk about future initiatives, please let's connect and give me a ring. I want to thank everyone for joining us. We have a packed day ahead. I hope you're ready for this virtual adventure. It's time to stretch and get back to your conference agenda so you can figure out where you are navigating next. I hope you enjoy the rest of the conference and look forward to seeing you in the networking sessions. Take care.